In the spring, it felt like watching a tsunami come in, where we knew we were going to have more and more cases. We didn't know how bad it would get. And then things really settled out nicely over the summer with social distancing and more outdoor socialization. But with the fall, people going indoors more, we are expecting to see a spike, and we've already started to see that throughout much of the country and around the world. Here in the emergency department, we've made some physical layout changes to help with keeping COVID patients separate from non-COVID patients. And so we have an entire section of our emergency department that's now dedicated to care of PUIs, persons under investigation, so people that we suspect may have COVID. We approach all patients with universal masking and eye protection and gloves to help with patients that we may not have recognized early on would be at risk for COVID. However, the entire area of our emergency department that is dedicated to COVID patients has stations outside of each of the patients' rooms. The beds are socially distanced more appropriately so that patient to patient there's not a short distance between them. And we have several negative pressure rooms where the airflow is such that we can have a sick patient or put in a breathing tube or suction or do something that's considered an aerosolizing procedure, but in a room with a closed door and negative pressure to keep the air inside. I have been seeing the mass fatigue both mostly outside of the hospital. Patients and our staff and care providers here in the hospital have been great. We have a universal mask policy. The patients are mostly good about keeping them on. But in the community, I've definitely been seeing some mask fatigue, both out and about. I think a lot of businesses are requiring masks. They're very well signed. But just walking around, I think people are getting tired of wearing masks. It's important that folks take it seriously and take the precautionary measures seriously. We know that mask wearing works. It takes a while for people to get used to. We all had to get used to wearing these for 8 hours, 12 hours. And initially it hurt our ears to wear our masks, and we felt like we wouldn't be heard. But we can hear and see fine with our protective gear on, and your ears will get used to it. But it's really the only way to keep people safe until we have a widespread vaccination program. I really hope that people get their flu shot and continue to do good hand sanitization and mask wearing, and I think that will make a big difference because it has. Here in Seattle, we've actually done fairly well compared to the rest of the country because we did have early adoption of mask wearing and early adoption of the stay home, stay healthy policies.